Hello and welcome to a new Pediatric Integrative Medicine class. Today we're going to talk about the newborn. My name is Josefina Llano. I'm a pediatrician and pediatric radiologist. So when the baby is born, the doctor that receives the baby will use this score that is called APGAR. The doctor will see the skin color, the pulse, the reflex and irritability of the baby, the muscle tone, and the respirations, and it will give him a score. So why is it important, this APGAR score? Because it's a quick test that is performed during the first and the fifth minute the baby is born, and it can tell the care provider how well the baby is doing outside the mother's womb. So a highest APGAR score will be considered normal and the baby can stay with his or her mom, but a lower APGAR score that it's in the minute 1 and still it haven't changed in the minute 5, then the doctor will have to take the baby and start the resuscitation procedures. So when the baby is born, the first thing we have to do is the skin-to-skin contact. It has to be immediate or as early as possible because we saw and we talked about it in the breastfeeding class that it's important to promote the breastfeeding. So we're gonna go through the 9 stages of the skin-to-skin contact and why it's important not only for the baby but also for the mother. So the advantages for the mother, we talked before about the oxytocin, that is a hormone that when the levels of oxytocin are up, then it can lower the levels of cortisol and this reduces the stress. So the mom will be more calm. And it also promotes the earlier expulsion of the placenta and a reduced postpartum bleeding. For the baby, we see also a decrease of the negative consequences of the stress of being born. And the two most important are the thermoregulation and the less crying. So the baby will also be more relaxed and more easy is gonna be the breastfeed. So here we can see the 9 stages of the skin-to-skin contact. The first one is called birth cry, when we can hear the sound of the baby crying, or also we can see the expansion of the lungs. Then we have a relaxation stage. Afterwards, the awakening stage, when we start to see the movement of the head and the limbs and the mouth. Then we have the activity stage, where these movements are more pronounced. Then the baby starts to move and starts to crawl to get near the breast and the nipple. Then it will make a pause because it was a really exhausting thing to move. So then it will take a pause and then it will start familiarizing with the breast and the nipple area. After the baby is familiarized, then it will start the suckling. And afterwards we have the sleep stage. So we said that the skin-to-skin contact has to be immediate or as early as possible. And another thing that is important is the clamping of the umbilical cord. So we know now that around 1 to 3 minutes, the umbilical cord has to be not clamped. So the baby will receive between 80 and 100 milliliters of blood. And this also will supply the baby with around 40 to 50 milligrams of kilogram of body weight of iron. So what are the benefits in the baby? One, for example, in term infants, it will increase the hemoglobin levels at birth and improves iron stores in the first several months of life. And in preterm infants will increase the red blood cell volume, so this will decrease the need for blood transfusion, and also it will lower the incidence of two of the most popular consequences or situation we see in preterm. There are the necrotizing enterocolitis and intraventricular hemorrhage. The first one is something that happens in the intestine of the preterm, and the second one in the brain. So just to make a quick conclusion, so the delay umbilical cord has to be around 1 to 3 minutes or until the cord stops pulsing, and this will benefit the newborn with blood and with iron. So it's important not to clamp the umbilical cord fast after birth. Another concept I want to introduce is called the vitamin K. Why is it important? How we give it to the babies? So first, the vitamin K is something that will prevent or will reduce the risk of bleeding in the newborn. So we know the newborn when he has to go through the birthing process, it is something traumatic. So the possibility of bleeding is normally not high, but it can be present. So the vitamin K will prevent the bleeding in the newborn. So it's called the hemorrhagic disease of the newborn. So the vitamin K, it should be administered by an intramuscular shot in the leg of the baby. And depending the weight of the baby, it's the dose we will use. And why is it recommended? Because normally the vitamin K is produced in the gut of the adults and from the bacteria in the gut. So the newborn still not have this bacteria in the gut to produce it, and also the mother cannot give many amount of vitamin K through placenta or through the milk. So it's important to give the vitamin K in a shot. And why a shot and not in drops? That it was also something that many people started to do, because they still saw that there were severe episodes of bleeding. So the most secure and the most efficient treatment with vitamin K is the intramuscular shot. And something that is important is that every time we do something to the baby, the parents should know about it and why we do it. So most of the parents were not understanding the situation and try not to be in favor of the vitamin K, but it was not because of the safety of or the effectiveness of the vitamin K, but because they didn't have the enough information or they didn't understood why the vitamin K was so important. So this is something that the doctor in charge should tell the parents. And to end and to start this discussion, we're going to talk about the parental care or the initial parental care, that it's when the baby is born, but also before the baby is born, to prepare for this new baby, and how this influences the course of the child development. So we know that the parenting behavior depends normally in the mother because it's the primary care person, but and most of the processes are guided by maternal hormones, distinct brain systems, memory and learning, personal history, and sociocultural context. So we see that maternal sensitivity predicts many positive child outcomes, including cognitive and socio-emotional development, self-regulation, and attachment security. By contrast, the maternal insensitivity and harsh discipline are associated with behavioral problems in children. So it's important to understand that not only the baby is born, but also the mother is in a new transition. So it's important that during the hospital and afterwards, the mother receives the support that she needs. And because this is also something that will benefit the parental care. And we know that maternal parenting is a highly complex phenotype with strong variation among mothers. So, is it important to support, to try to understand what's going on with that mother and try to make the best context possible? So, thank you. My name is Josefina Patjano. This is Pediatric Integrative Medicine the Future. I hope that you understood what I was trying to explain. And if you have any doubts, you can leave a comment, or if you have any questions or anything that you want to know, it's also important that you tell me so we can discuss it in another class. Thank you and follow us for more.